All right. Welcome, everyone. It's great to see so many people here from all over the world. It's really an incredible thing that we're all able to congregate here. To kick off this event, I have a African proverb that many of you are familiar with, but I thought it was really appropriate for this particular event. The African proverb is, if you want to go fast, go alone. If you want to go far, go together. I first moved to Malawi, Africa back in 2013, and at that time, I was first exposed to global poverty. I was a private school kid, and then I was exposed to global poverty, and I felt this urgency that I wanted to act with all the suffering I was seeing. And that urgency was good, and that passion was good, but you get burnt out when you try and do everything yourself and try and carry the whole weight of the world suffering on your shoulders. It's not going to work. So after getting burnt out, I went on a journey that eventually led to the founding of DonorSee, and that's where we are here today. We have DonorSee donors here. We have people from DonorSee partners from all over the world, and then we also have our extended community. And it's just a place where we can all be together. And I think by being together, we'll be able to go a lot farther. So, in the spirit of togetherness, I'm going to introduce our three panelists today. Dr. Paul Chinchen from the president of African Bible Colleges, Dr. Trish Scanlon, the CEO of TLM Tanzania, and Diana Ninsiima, Tanzanian Director of Digital Opportunity Trust. Thank you all so much for being here.
Thank you.
It is so great to have you. So I'm going to have you each introduce yourselves a little bit further. So Paul, why don't we start with you?
Okay. Well, Gret, thank you very much for organizing this conference and for inviting us to be on the panel. Great privilege. As you said, I'm the head of African Bible Colleges. Our mission runs 3 Christian universities in Africa, in Malawi, where I have been based for the last 30 years, since 1989. In Liberia is actually where I grew up. My family moved to Africa. My parents did when I was 6 years old in 1970. And then one in Uganda, and our family also lived up there in Kampala. So we have the 3 African Bible College campuses. I'm also involved in mass communication. We have Christian radio stations in all 3 of those countries, Liberia, Malawi, Uganda. We also have a television station, so I'm in Malawi, so involved in mass comm. And then also medical work. Our mission runs a mission hospital in the capital city of Malawi, Lilongwe, quite well-known ABC Mission Hospital in Area 47. So a little bit of my story, just very briefly. As I mentioned earlier, I grew up from first grade until I finished high school in Liberia. I finished at the U.S. Embassy High School in Monrovia, went to university in California, met my wife, is from San Diego, and we went back as a young couple with a 5-month-old daughter in 1989 to Malawi, where we were building the ABC campus at that time. And so I've been teaching there, running there, started the hospital and the day school, and that's where I got to know you, Gret, was at the ABC Christian Academy that my wife runs in Lilongwe, kindergarten through 12th grade. And so we've raised all 5 of our children in Malawi. All of them have attended the ABC Christian Academy. 3 of my kids were born in Malawi at our mission hospital. And so that's an important part of who I am, is Malawi and Liberia is my background. Although I'm based right now in Jackson, Mississippi, is where our headquarters are for our mission.
Thank you, Paul. Diana, why don't you go next? Please tell us about yourself and what you do.
Thank you so much, and thanks for having me here. I am Diana Ninsiima. I'm based out here in Dar es Salaam, Tanzania, but I have a footprint across the East Africa region, partly from Rwanda and Uganda and Tanzania as well. So I lead an international nonprofit called Digital Opportunity Trust. It's Canadian. We've been in Tanzania for the last 7 years, and we support young people in the area of social innovation, digital inclusion. So we basically train university graduates who are fresh out of college and they don't have a job, and we equip them with the skills to go back to their communities where they facilitate entrepreneurship, ICT, and social entrepreneurship. And in the end of the day, they also set up their social innovation. So we help them to ideate their enterprises and connect them through the value chain of support, where they can actually launch and scale their enterprises as a result of really becoming the change agents and also contributing to global development. Thanks.
Thank you, Diana. Dr. Trish, please go ahead.
Thank you, Gret. And again, thank you for the opportunity to be here and to speak to this wonderful audience. I am Trish Scanlon. I am a children's cancer specialist. I'm from Ireland, but I have been living and working in Tanzania since 2012. And in that time, we have built a national network of children's cancer services through the government hospitals or faith-based hospitals. We in the hospital that I work in, which is also in Dar es Salaam, like Diana, we have a very large ward with about 80 beds, and that's in the government hospital. But I set up a charity called Their Lives Matter, or in Kiswahili, it's Tumaini la Maisha, and we're basically the charity of the gaps. So the hospital is amazing and it provides everything it can free of charge for the children. But anything that the hospital does not have, then the charity provides. So, for example, we pay for all the chemotherapy for all the children in Tanzania who have chemotherapy. We have a hostel. We have play and nutrition. We make about 120 liters of smoothie for the kids every day. And so we try and have a fully encompassing service for the children, which is entirely free of charge. So the hospital doesn't pay, it doesn't charge anything, and we make sure that the other costs that are covered by ourselves. And we have collaborated with 11 sites around the country now, and the idea is to get to 30 sites so that no child is more than a 4-hour journey from a site that knows how to get that child into the network and access free care. And the only other significant thing about me is that I have had breast cancer twice and have survived it both times, which I think has given me kind of a unique view of looking after people with cancer and giving them, the hope that, all is not lost when you get it, even when it relapses.
Yeah, thank you for sharing that to you, Dr. Trish, and to Paul and Diana. It's, again, really great to have you all here. The first question to kind of kick things off, we live in a world that, if you hang out in America for a year, or if you hang out in another part of the world for a year, you might have a completely different experience, and those experiences can be hard to communicate across cultures. So I would love for you to talk about some of the successes and the struggles you've had in communicating the experiences of the people that you're serving. So it could be either the children with cancer that you're serving, Dr. Trish, or the students that you work with, Dr. Paul, or even the business entrepreneurs, Diana. But Dr. Trish, why don't you start off? What are some of the struggles and successes that you've had in communicating the experiences of some of the people that you work with?
So, to be honest, probably the biggest kind of divergence from what is happening is that people who are not in Tanzania don't realize how sophisticated the care can be. But in general, looking after the children and trying to express how sick the children are and how much help we need has become easier and easier as time goes by. My first time on the continent back was in Kenya in 1996, I think it was. And in order to communicate with my family, we were in a little village hospital. I had to send a fax. And, these days, the technology that's just at our fingertips has made things so much easier, I have to say. And to be honest, as one of my mentors said to me in a kind of a flippant but really impactful way, if you can't explain the need of children with cancer to people and why they need care, then you might as well go home. Like, it's really an easy sell. No child should have cancer, first of all, and no child should die needlessly of cancer, because 90% of children in Ireland, where I trained, are cured from their cancer, and most people have an understanding of that. So people want to help children, and they particularly want to help little ones with cancer. So I don't find it a struggle.
Gotcha. Thank you, Dr. Trish. That makes a lot of sense. Diana, what has your experience been in trying to communicate some of the experiences of the people that you work with?
Yeah. So I guess for me, there is an interesting phrase around the danger of a single story. And I always draw back on that. There is a version of a young woman that the world is yet to know. A young woman who has finished college, and she's really very passionate to change her community. She's passionate to be equipped to transform. And yet we still paint this picture of another woman in the village, yet this young woman, once equipped, she can do that ripple effect within her communities. She can create the solutions within the communities. But I feel like most of the interventions that we do actually bring on board, even at a global level, they are more around let's go fix something. But at times there's nothing to be fixed. At times it's really unlocking that potential that then can be sustainable on the ground, instead of really coming in and saying, this is a grant to build boreholes. But there are young people that can actually create something innovative and sustain it over time. And so I believe that really at a global level, people need to change the way they look at young people, especially even in Africa, and the way we actually have the potential to solve some of the most dire problems that we have at the moment.
Yeah, you clearly have a heart for that, Diana, and I know that you've done a lot of work with gender equality, and you'll be part of a female social entrepreneurship room later on. So if anyone's interested in diving further into that, I think that they should check out that room. Paul, what about you? What has been your experience communicating the experience of your students and whoever else in Africa?
No, that's a great question. And I think there's two parts to it. One, Trish and Diana both touched on it, trying to communicate to people in America the tremendous disparity that you have in Africa. Americans, some think maybe they've seen poverty. Maybe they've seen homeless people in LA or San Diego. Maybe they've crossed the border to Juarez or to Tijuana. But they really haven't seen extreme poverty. But the disparity between what Diana and Trish have described in the cities, where you have resources, you have access, you have internet, you have phones. These are tremendously developed cities. They're in Dar es Salaam. I'm in Lilongwe, Malawi. These are very developed, well-developed cities, well-organized. But then as soon as you go even 2 miles down the highway, you're in a village setting where most people have never gone to school. Most people are rural farmers. Most people live in very rural conditions. So you have this huge gap between people that have and people that don't. So trying to have Americans, let's say in particular, or Westerners in general, try to comprehend and process that, it's a difficult thing, the huge disparity. As for me and the work that I do in trying to educate students at the university level and really give them a long-term future, that is a challenge, trying to communicate those needs here in the U.S. Americans are very, and I don't want to keep saying Americans, let's say the rest of the world or the Western world is very switched on to what we would call maybe immediate needs, like medical needs. You ask for some examples of success stories. When we have a need at our hospital, and like Trish described at her hospital, people are very generous with helping with those immediate needs of somebody who's sick. You have short-term needs, kids that need to go to school, kids that need orphan care. So that's short-term up to maybe the age of 18. So in those two cases, I think people are a little bit more generous. Getting the rest of the world to think and to see Africa long-term. So we need to get past the immediate need, the short-term need, but long-term, what's going to raise the whole tide of Africa? And it's really getting, as Diana described, not just getting them a university education, which is what we do at African Bible College. That's what my passion is, taking young people from a secondary school, giving them a real skill and a job where they can go do something incredible, really anything. The doors are so wide open with people that have a good education in Africa. It's almost limitless. So giving them those opportunities, but trying to explain to a Westerner or an American the difference that makes, it's hard to communicate because they don't really understand, because here in America, we almost take for granted the idea that a kid can finish secondary school and he wants to go to university, let him go. He can go to a community college, can go to a university. He has so many choices. It's not like that in Africa. So getting them to understand and appreciate that is difficult.
Yeah, I think it's, as we're all talking, it's been very interesting to see that we've got three very different types of work on this call. We've got the medical work, the business entrepreneurship work, and then we've got the education. So very cool that we have such a robust discussion here. But the next question, even though there's this diversity of the things that we're working on, I bet you there's this common experience that all of us have and all of the people on this particular call have. And it's the idea of suffering in the world. There's a lot of suffering in the world. And a lot of the people on this who are watching right now are probably very curious. How do you personally deal with that? You must see a lot of it. There can be some tragic things that you see. So on a personal level, how do you grapple with some of those things? Diana, I would love for you to start first on this one.
Suffering in the world. Again, for me, it's been interesting to see everything through the lens of young people. There is a lot that they come through with, even as innovators. I'll give an example of a young woman who really maybe was faced with her auntie dying before even reaching to the hospital, because she did not even have a medical kit or anything. And she's here trying to struggle and see, how do I create a medical kit that is accessible and cheap and very easy for a woman to get in the village? How do I create that? And what do I need, can I get from you as DOT in terms of really equipping me with experience, resilience, the networks, the tools, the resources that can help me to do that? So it's been basically seeing that through a lens of many young people, and knowing that at times we don't have enough to support enough of young people to really realize that dream that they have to create as a result of the challenges that they see in their communities. But also it's been a rewarding experience for whoever has really made it work in their different sphere in terms of setting up their own initiative, because we don't just set up businesses, we set up social businesses that really look into the problems that people have and design as a result of the people's problems. I usually give this example, and it's a very common story that people use a lot in Dar es Salaam around the, like the Western thinking around funding. So there's a given project that was set up in the community. I'm sure very many people know about this story. And it was a borehole project, to set up boreholes in the communities where women would put water and not go very long distances. And when they set the boreholes up, the women still went 10, 20 kilometers away to fetch water. And only for them to realize that the challenge was never that water is far, but because they wanted to network, communicate, and, think about how they could build maybe village community banks, be free and breathe and think about their children's future and long term. But to find that resources could be wasted in a way that we just assume, make assumptions of what suffering and poverty is, instead of really listening to the needs of the people and designing from their end, has been one of the greatest experiences for us in terms of designing with our users, but also designing with the young people to live their dreams.
Yeah, I love the reaction, and I love the entrepreneurial spirit behind seeing a tragedy and seeing something that's broken and then saying, okay, so what can I do? That's really cool. Thanks, Anna. Dr. Trish, what about you? On a personal level, you work with some of the most tragic cases that you can possibly imagine, I think. So how have you personally dealt with that?
Yeah, it's a question that a lot of people ask, particularly pediatric oncology and particularly pediatric oncology in Africa. I've probably seen more children die than most people on this earth, to be really honest, because even though we've done extremely well and we've moved survival from around, less than 10% to now approaching 60%, there's still a lot of children who don't make it every year. So part of it is, that you've done your best. And I think if you bring your best to every day, and part of our role is curing where possible, but soothing where that's not possible. And some of that is obviously medication, but some of it is sitting with a family and explaining what's going on, because I find that a lot of times, and this is not unique to Tanzania, this is across many branches of medicine, everyone's so busy that, some very major diagnosis is just thrown at a family and they don't really know what to do with it. So one of the main things we do is spend a lot of time with families. And if there are no more choices that are curable, explaining that clearly to the family, saving them the problem of going, still looking for a cure, still spending money, in something that's not going to help them, and giving them the reassurance that we're there for that child right until the end. That really helps. Another thing is, I remember back when I was training in Ireland, there was a little girl who had been in hospital with us for a very long time because she had very intense chemotherapy and she was sick all the time, but we all loved her. Anyway, it didn't work. And this day, it was maybe 6 o'clock in the evening, she died. And there was a lot of us still around, and we were actually around her when she died. And most people, doctors, nurses, attendants, cleaners who were in the room with her were visibly upset. And some of them, my junior staff now, would say if they get emotional, that they sometimes come and apologize and say, oh, I'm so sorry, it was so unprofessional. And I tell them this story that happened. And 6 months later, a letter was written by the little girl's mom to the consultant who was looking after her at the time. And one of the things she said, obviously, that she missed her little girl every day, but that she remembers very clearly the emotion that all the staff had shown at her death. And so it felt to her that she wasn't a patient to the staff, that she was really someone that everyone cared about. And that really helped her get through the darkest days. So for me, it's not about becoming hardened or, cold to these situations and the suffering of the children. In fact, if you have become that, then you really need to get out of this. But it's about showing and allowing yourself appropriate emotion, not sobbing, but, being appropriately human and upset when things happen. I also have, 3 categories of children. There's a group of children where, they come in, they're too sick, it's too late, and they die. And although that is tragic, we haven't actually very strongly connected with those children. But what we do feel very, very, very strongly is that's what we need to do for the next child, is make the access better for the next child so that the next child comes in earlier in that child's situation. There's the next group of children who are kids who go through the treatment, they do beautifully, and they're with us for a very long time. And then for some reason, they come back and they relapse and they die. And they are so sad because they're your little friends that you've known forever. And then the final group are kids who die because you or the health service or the system has failed this child in some way. And they're the kids that keep you up at night because they're the ones that should not have died. But they are also the ones that you should never forget because you're disrespecting them by doing that. What you need to do is analyze very carefully what went wrong and what could go better. So when you have a system like that where you know how you're approaching the sadness that's happening and what you can do better for the next child, then that makes that child almost, the I don't know how to say, like the poster child, it's just the wrong word, but if you know what I mean, for the change. They reflect the change. And what happened to them is an important lesson in what's going to happen next.
Yeah, that's really beautiful, Dr. Trish. Thank you for sharing that. And I love how concisely you put it. You just said if you just do your best every day, that's something that you can do. And that's really good advice. Paul, you grew up overseas. So what has your experience been like?
Yeah, in Liberia and West Africa. And this is a good question you're asking, is how do you communicate the reality of global poverty? Like I said earlier, let me just clearly communicate to people that haven't been to Africa. Africa is developing rapidly. I could drop somebody off in an airplane in Dar es Salaam, Lusaka, Zambia, Kampala, Uganda, and they wouldn't know if they're in Africa or Little Rock, Arkansas, or Mobile, Alabama. That's how quickly these cities are developing tremendously rapidly. But as I said earlier, there's huge disparity. When you leave the city and you go into the rural area, these are people that have very little. And Gret, you take teams over there to Malawi, and we do as well. And most teams that come from the United States come during our summertime, which is winter in southern Africa. And so it's cold. Malawi has elevation almost long ways up at almost 4,000 feet. So when you take these people from the U.S., they go into a village, the first thing they'll say is, why don't the kids have shoes on? Why are the kids so cold? Because every church group you bring from America, they want to play with the kids, hold the kids, and they're, oh, these kids are so cold. Why don't they have long sleeve shirts? Why don't they have shoes and socks on? So that immediately hits a Westerner when they arrive in Africa. But as far as a specific story to tell you how how, let's use the word, difficult and desperate it is for these people at times. I was there when we had our worst drought in Malawi. We opened our mission hospital in Lilongwe in 1999. And then 2002, 3, 4, those 3 years that we had a terrible drought in Malawi, probably went up to where Diana is up in Tanzania as well. And so in Malawi, crops don't grow. If it doesn't rain, everybody's very dependent on rainy season to grow their maize. And so if the rains don't come, there's no maize, there's no vegetables. It's a huge problem. So by the third year, 2004, at that time, our mission hospital was being run by Pauline Bongiorno, my wife's mother, my mother-in-law. And let me add to that, as we go through this conference, I'm going to tell a lot of stories about our ABC graduates, because when Pauline Bongiorno left, she handed that hospital over to one of my graduates, Mala Kawali from ABC, and she's done a beautiful job running our hospital for almost 7 or 8 years now. But when Pauline Bongiorno was there, we had this drought, 2004, and people would come, they would walk and bring their children to the hospital. They would give them the medication, give them their treatment, and they would explain to the mother, now when the children take this, they must eat it with food, either nsima or they can eat it with the bread. And the mothers would tell the physician, Pepani, we don't have any food in the house. And this just tore up my mother-in-law. So she started writing Friends in the States. And so we started a program where everybody that came from any rural area, the people in the city always seem to have money and what they need. But from the rural area, they were given a loaf of bread. So at least the children could take their tablets with food when they needed their medication. So that's something that no American that's alive today has experienced, not having bread in the house so you can take your medication with food.
Yeah, thank you. I do want to ask, so I think we've got a little bit of time left, so I think this might be the last question. And it's a question that I ask myself a lot, and so I'm always thrilled to hear what other people have to say about this. If you could go back to when you first started getting into this space, the space of either helping children at the hospital or helping people start businesses or helping students get educated, if you could go back to when you very first started out, and you could give yourself some advice, you could say, hey, watch out for these pitfalls, don't make the same mistake again, what would you tell your former self back then? Dr. Trish, why don't we start with you?
2 very brief things. One is maybe choose your battles a little more carefully. You don't have to win everything. It's okay if it doesn't always go your way. That's okay, because you waste a lot of energy in small battles. And the second thing, which I think is really important, probably the most important lesson that I've learned, is that failure isn't failure. Failure is part of the process. And there's actually literally nothing we have tried to do that didn't start with step 1, fail. And that is actually a learning, that's something you need to go through to find out what doesn't work in order to direct your efforts in the correct way. So every time you fail, you're making progress, and keep at it.
Gotcha. Paul, why don't we go to you next? What are some of the things you wish you could tell yourself back when you first started?
Yeah, the first thought is don't try to do it all. By the way, Gret, I need to promote your book a bit. Your book is fantastic, talking about ministering in Malawi and overseas if the poor live next door. Great book. Another great book is Kisses from Katie. And it's a young girl that has adopted kids in Uganda. And in that book, she says, you can't do it all. You try to do everything, you're going to kill yourself. She said, some days I wake up and I feel like I'm trying to empty the ocean one dropper full at a time. In other words, you're never going to be able to do everything. And so she says, you wake up with the attitude, do as much as you can today. That's really important. So don't try to do it all, but don't try to do it all yourself. And I would say the most important time that I've spent is not what I've accomplished, but what you've done working and mentoring other people. I learned early on at African Bible College, I need to spend time in the classroom to get to know the students, not just doing office work, not just working on projects. And part of that was coaching basketball, which when you were in Malawi, we had a great basketball team at that time. And not only is there joy in that, but you get to know people at a very personal level. You go to their homes, you travel with them, you ride in the bus, you sleep together. That's how you really get to know and mentor, because no matter how long you're overseas, no matter what country you're in, sooner or later, something like COVID-19 or it could be Ebola is going to force expatriates to leave. The question is, have you spent the time mentoring someone else that can step in and do the job, not as good as you, but probably even better? And again, I could tell so many stories of our African Bible College graduates that I spent time with, coaching them on my basketball team. One of them was Chakuchanya Halawa. When he graduated from ABC, got a job with BBC in London, and is now, you turn on Focus on Africa, you're going to hear an ABC graduate that used to play on my basketball team, Chakuchanya Halawa. So that is a tremendous joy to me to be able to work with these people over the years. Another good example would be Alberto Paxis. He was probably our greatest basketball player of all time at ABC, but when he graduated, came and did his doctorate at University of Southern Mississippi in Hattiesburg, and then became the athletic director at Belhaven College, the college my mother went to. So here's a former college student in Malawi that was one of my basketball players, finished, did his doctorate, and was head of a program at the college my mother attended in Mississippi. So that is a very rewarding cycle to be a part of. So, but the emphasis there is spend time mentoring other people.
Gotcha. All right, Diana, we got you back just in time. Yeah, would you mind if you're with us? Would you mind talking about what you would tell your younger self if you could go back in time?
Thanks a lot. I think I would really love to echo what Paul just said around mentorship. Really, I would go back and I really speak this just on the aspect of back then being a young woman. I would really want to reflect and do a lot of radical empathy and understanding, really going into the footsteps of really what these young women face. Entrepreneurship or leadership is very lonely, and it really takes another person to really understand your journey and know how to walk with you every step of the way, become that safety net that you can rely on. But over time, we get to treat people as groups. You go to Africa, you think it's Africans, you think it's college graduates, but they are individuals. And if you really get to understand each and every one of them on a radical individual level, you get to really understand how you can customize that support for an individual. So I would really go back and say it's a beautiful road. And for young women especially, it's very unique because we grow up in cultures where there are very few role models, very few mentors, and we all know that you cannot be what you don't see, especially as a woman. And knowing that I have to walk every day trying to set that example to empower the next young woman to really rise up and realize their own potential and also what they can contribute to the world.
All right, that's excellent. So we're about to transition. Why don't you quickly talk about, I think all three of you are going to be in a different room. So Paul, you'll be in the Working with Global Teams room. Dr. Trish, you'll be with the Generosity in Healthcare room. And Diana, you'll be in the Female Social Entrepreneurship room. And then we also have the donor hangout room where donors can hang out with each other and talk to each other about their experience. We have the DonorSee Partner Ask Me Anything room. So we'll have a bunch of DonorSee partners in one room and you can ask them whatever you want. They know what they're getting into. So anything you want to ask them, feel free to go ahead. And I think we have, the Finding Your Purpose room, which will be led by Sarah King and Sarah Brook and perhaps a few others. So thank you all so much for doing this. Before we release, I would love for the three of you to talk briefly about what you hope to cover in these rooms that you'll be speaking in. So, Paul, with your Working with Global Teams room, you'll also have some members of Children of the Nations there. So, we'd love to hear more about that.
Chris and Debbie Clark. You've got two all-stars there. People should look forward to hearing from them. But covering how critical it is to get people overseas to see things firsthand and how important that is, how meaningful it is to that individual, not just what you accomplish when you're in country, but as far as organizing trips that are meaningful to the person that's traveling, finding ways to engage them every day to make the trip enjoyable, and then explaining how life-changing it is. Not necessarily life-changing for the people you're going there to minister or work with, but life-changing for that person. It opens up their eyes to the whole world, and it gets in your blood, and it becomes a part of who you are, and you build an organization like DonorSee because you've been there and seen it and experienced it. There's nothing takes a place of experience. I could sit here all day and tell you what it's like to ride the Matterhorn at Disneyland. I've probably ridden it 3 or 4 times in my life, and I could spend 30 minutes describing the Matterhorn, the greatest roller coaster in the whole world. But until you get on the Matterhorn, you really don't know what it's like. And it's like going for your first time to Africa.
Absolutely. I couldn't echo that enough. Diana, in your room, in the female social entrepreneurship room, you'll have some other people there with you. What do you hope to be talking about there?
Yeah, I would like to say that Beyonce is wrong, or was wrong, when she says who run the world is girls. Girls don't run the world yet, but they are yet to run it. And so we'll be speaking around female entrepreneurs and how we can support them. What are the prevalent challenges that they go through, but also what does it take to make a young female entrepreneur thrive? Yeah.
Awesome. And Dr. Trish? You'll be in healthcare and generosity, right?
Yeah. So I think the most important thing is a lot of people think when they think about Africa, the country of Africa, and particularly healthcare, they're thinking about poverty and they're thinking about malnutrition. And I think really refocusing that on how exciting and how fast things are developing, and how like a place like Tanzania and Dar es Salaam, and even the hospital, Muhimbili Hospital, the opportunities, the things that I have seen change over the last 10 years, just the energy, and maybe listening and hearing from other people what they have experienced, but just changing the narrative around that from one of sadness to one of real hope and energy, and, just looking towards the future.
Awesome. Thank you so much.